start recording. Okay, good morning, everyone. Happy Wednesday. Obviously, you can see I'm not Jennifer. Jennifer, unfortunately, is sick today, so please send her your well wishes. So I will be covering and help facilitating this meeting today. So with that, just be generous in case I forget anything. I'll be reading her notes from me. So again, good morning. Welcome to the RN webinar. So today, let's see, the webinar will be recorded. So just want to let you all know that. Please make sure that your cameras are on and your mics are muted unless you have a question later on and it's prompted. Let's see. And then just some logistics that she has here for you all. Just remember, you're going to sign it in the chat box by entering your name and site for attendance purposes for this role webinar. So just your name and your site for attendance purposes. Our colleague Catherine will be taking care of that. So thank you ahead, Catherine. Please, again, keep your cameras on a majority of the time. We understand if you need to step away for anything. You may do that, but if it's going to be longer than a long amount of time, you need to let us know. We just want to make sure everything is okay on your end. If there are any questions at any point of this webinar, please feel free to raise your hand using the raise hand option or enter your question in the chat box and we'll be sure to address it. If there are any technical questions, please message me directly and I'll be able to help you on my back end as much as possible. Also, again, that there will be an evaluation that will be presented at the end of this webinar. So right when this webinar is over, don't log off right away because I will be adding an evaluation survey link at the end in the chat. And with that, does anyone have any questions before we get started? If you need to message me directly, that's totally fine. Okay. Just make sure everyone's muted. And again, thank you for those of you that just joined us. Please remember to log in the chat for your attendance, so your name and your site. And with that, today's webinar will be about supporting pelvic floor healing. And your speaker today is Dr. Carlin Reaume. I hope I pronounced that correct. It's very pretty when you pronounce it that way. Dr. Carlin is a licensed occupational therapist with a board certification in lifestyle medicine and additional specialty certifications in pelvic health, Pilates, pregnancy, and postpartum corrective exercises, and perinatal mental health. Dr. Reaume is also a registered yoga teacher, a graduate of Loyola Marymount University's Yoga Therapy RX certificate program, and a certified postpartum doula. After completing both her master's and doctorate in the University of Southern California, she created a career weaving together her background in mindfulness and movement in order to forge her own path in the world of wellness and women's health. She launched her pelvic health private practice, supported Mama in 2020 with the goal of helping women reconnect to their bodies after pregnancy in a way that supports both physical and mental well-being. She has presented her work as a perinatal health expert at professional conferences and academic institutions throughout the country, as well as been featured on numerous podcasts. Her work has also been featured on the Amazon Halo Fitness app and Pilates.com. Dr. Reaume currently serves as assistant clinical professor for the Doctor of Occupational Therapy program at the University of the Pacific in Sacramento, California. And with that, please help me welcome Dr. Carlin Reaume.
Thank you so much for that, Terry. I am so happy to be here with you all. Oh, thank you. That's nice. What a warm, welcoming group. I'm really, really excited to be here with you all today, and I feel so grateful that Jennifer found me. I am incredibly passionate about providing support for this population, and as she was sharing a bit about what you all do, I'm just incredibly excited that you all are providing the care that you are to the people within the community that so desperately need these supports. So really happy to spend some time with you this morning. I want to make sure to try to, I mean, obviously this is a massive topic, and so I'm going to cover as much as I can. I want to make sure that I address any specific questions that you might have, any burning questions. So please feel free to, as Terry mentioned, raise your hand, add questions in the chat as they arise. There will be a portion of time at the tail end for questions that weren't addressed throughout the content of the presentation. But we're gonna go ahead and dive in. These are, let's see, hang on a second. Okay, here we go. So these are the objectives that I'm intending to cover for you all this morning. And I think my goal is for you to leave feeling confident in all of these areas. I know the majority of you, if not all of you, are have nursing background. So a lot of this, I imagine, will be review slash, review. But I want to make sure that we all are on the same page as we move forward in some of this content together. So you all got a general understanding of my background as Terry read through that bio. So you have a sense about who I am, and I'll explain a little bit more. But as I'm going through this, if there's anything specific that you feel like you want to make sure I touch upon, if you could enter that into the chat, I will go ahead and take a look at the chat before we dive into the content. So how many of you, if you could like raise a little hand emoji, I feel like you're really familiar with occupational therapy. I'm just kind of curious. Like, have you worked alongside OTs in any of your roles? I'm seeing no hands. Okay, one hand, two hands, but a couple. Thank you. Okay, okay, great. Okay, cool. So I'm a very passionate occupational therapist. It's like part of my mission to spread awareness of our profession throughout the healthcare industry, as well as just kind of the broader population. I'm definitely, we tend to be a profession that people don't know well, or are confused about the roles that we can serve, because our profession is very broad. So occupations are the meaningful activities that occupy people's time. And so it's not just what they do for a profession, but it can be anything that they need and want to do in daily life. OTs, that's our goal, is helping support people get back to that, return to those things that are most meaningful to them. And very often you'll encounter us in hospital settings where we might be supporting people in returning, dressing, toileting, etc. But we also work in a lot of other areas. And so my background really focused on looking at the mental health side of things, and how can we promote health and well-being in any environment. So not just people who've had an injury or an illness, but the broader population could also benefit for looking at their daily habits and routines, and are there things that they could shift in how they're going about their day in order to bring in more health promoting activities, or bring in more meaningful activities, things that enhance health and well-being. And so this is my area of focus throughout my career in different settings. I was on faculty down at USC, providing some care to a non-traditional population. I was working with college students and looking at, as they transition from high school into college, that's a time where a lot of health habits can go awry, or a lot of times where there's an increase in stress level given the workload and all of that, so we can see increased diagnoses pop up and that kind of thing. And so it was providing support during that time of transition. And so I share this just so you all have an understanding that my background was supporting people during times of transition for a long time when I was working with that college student population. Well, fast forward, I ended up meeting my now husband. I moved to Northern California. We got married, had a baby, and I'm very open about sharing, I had a very challenging personal transition into motherhood. And throughout that time, I had, really intense postpartum anxiety, and postpartum depression, and some like physical ailments. And I kept thinking, I wish I had an OT alongside me who could help me navigate these transitions, both from this psychological, from a mental well-being standpoint, where all my daily habits, routines are different, my roles, like the expectations of me, are different, and also the demands on my body are different. There are all these repetitive tasks that I'm, needing to do. My connection to my body is different. Like, I grew up dancing, teaching Pilates, yoga. I was very connected to my body pre-pregnancy, and then I go through pregnancy and postpartum, and movement felt different. I had aches and pains. I didn't feel like I knew how to support myself in postpartum healing, and there was no place to. I didn't feel like I had a place to ask anybody about that. Like from the broader, like I didn't have any huge complications. I didn't have an infection. Like I was healing well, and there was still a gap in my healing. So I ended up launching Supported Mama in 2020. So I gave birth to my daughter in 2019, and like the wheels were turning, and 2020 came, and I was like, I just need to do this. Like I felt called to do this because, as you all know, like this is just such an area of need, all things around all of this, right? And so I'm like, I want to bring my background to providing support in this way. So that's when I started my private practice. It started off, with COVID. So, it's virtual, and then it morphed into in-home mobile visits. Um, and then a year ago, a little over a year ago, I got a physical location, a brick and mortar. So I see clients there throughout all stages, through all, the entire perinatal journey. I would say the bulk of my clientele are postpartum now, anywhere from 2 weeks postpartum to, postpartum's forever. So I have people who have children in their, around 10 years old, 11 years old, who felt like they didn't have a place to ask questions, or still have, they might have pelvic floor dysfunction, or looking at trying to heal in a different way. So that's a little bit more about my background. And, I do have this lens as an occupational therapist, and then because I'm fascinated by it and I just really love learning, I've dived into a lot of additional coursework specific to pelvic health, perinatal mental health, et cetera. And so that's where I'm speaking to all of this from. So, okay, let me see. Have any of you entered? Okay, I'm not seeing yet anything in the chat about specific things you want me to cover. So feel free to, as they come to you, feel free to add that in. But like I said, there will definitely be space for questions. All right, so let's dive on in. Okay, so just to orient all of us, here's what we're talking about. The pelvis that we all know and love. And I want to, very often, people will come to me and they'll say, I don't know what my pelvic floor is. Do I have one? Everyone has a pelvic floor. So this will be, our conversation will be focused around, people who've been giving birth today, but I work with a lot of, just as I'm doing this work and I'm out in the community speaking about the work that I do, I'll have, like, my husband's like, oh, well, I don't have those pelvic floor muscles. I'm like, actually, you do. And so a lot of education just around what this is and how we all have it. And it's an important part of our body. So the bony landmarks that we use to identify the areas of where the pelvic floor are on either side your sits bones or your ischial tuberosities. So a lot of times when I'm working with people, I'll have them just feel like under their seat. Can you find those bony ridges? I have my little pelvis model here too. So just on the bottom, these two bony landmarks from side to side, and then your pubic bone in the front and the coccyx in the back, or the tailbone. Oh, thank you. You've spotlighted me. Okay. So those 4 points from side to side, the sits bones, pubic bone in the front, tailbone in the back. That is a helpful beginning point to just orient everyone to what we're speaking about here. And all of our pelvic floor muscles attach to those 4 points. So it's helpful for people to just understand where those are in the body. So I'm going to move forward then to the muscles that attach. Okay, so if we have someone laying supine or on their back, as you might see, very often this is a position in which people are giving birth. These are the superficial pelvic floor muscles. And so we have about 14 different muscles that are in the pelvic floor. Some of them are superficial and some of them are deep. We'll get to those in a moment, but the superficial muscles, really helpful to just see how many there are here. And this is something that's surprising to people, that there are muscles that exist here, because usually we don't, if I say flex your bicep, we all know like where that is. We know most people, well, we all do because we're in healthcare, but like the average person knows knows what that is, knows how to access that muscle. When I talk about these muscles, people tend to not have any connection there. They don't, it's amazing how many muscles there are here. So I really like to just kind of highlight, look at how complex this system is, how many muscles you have at the base of your pelvis here. So when you're sitting all day, like there's pressure on those muscles. And so sometimes for people, there might be some tension here. Definitely during pregnancy, there can be sensation to end afterwards, which we'll talk more about. But the superficial muscles can be very tender. There can be weakness. All of these muscles, just like we get muscle knots, like in our neck and our shoulders, you can get muscle knots or tender points in these muscles. And so the superficial muscles can feel good if you have like a little lacrosse ball or I call them a pinky ball, like a kind of like a soft tennis ball, depending on, you don't want it too firm. But for a lot of people, this is something that I do in pelvic floor therapy is I just guide them on self-massage of these areas. Because very often people hold tension in a lot of these. So that can be something that I provide education to them about. You have access to providing some relief here to these muscles that are superficial. And we talk about different strategies they can do that. And while I'm here, we'll just highlight the perineum, this area right here, which you all know can be greatly impacted by vaginal birth. And so we'll talk more about that right there. But the number of muscles that come together at that point, and then also the nerve endings, this is certainly an area that as a pelvic floor therapist, I spend a lot of time providing education around and some healing and support there. And then if we go to the deep muscles, I think actually your image that you can see on the screen is better here to just appreciate how many muscles are deep. But I want people to know that these are muscles that sit inside of the pelvic bowl, like inside of the muscles or of the bones. So you can't access the deep muscles by just like palpating with your finger. This would be in pelvic floor therapy. We can provide some internal support to or work on the muscle knots, if you will, digitally. Like I can go in intravaginally or interrectally. Some treatments will address some of what's going on with the muscles there. But people also, there are pelvic wands. So later on, this is something that I work with people on is providing some education about pelvic floor wands, and they can have control for themselves on providing internal release to some of these pelvic floor muscles. But I just want to kind of let you know that there's layers 2 and 3 of these pelvic floor muscles that are really significantly impacted, obviously, during pregnancy and delivery. So just to orient us all so we know what we're talking about, those are the muscles that generally get neglected. They don't get a lot of attention. So that's what we're talking about today. All right. So what are the functions of the pelvic floor? So the first is support. So in the pelvic bowl, this is where all of our organs sit. So you all know we've got the bladder right here, right behind the pubic bone. Then we've got the uterus, vaginal canal and uterus. And then we have the rectum behind here. Now, we know that these are really closely connected. So anything that's going on with one area likely impacts the other areas. So as baby grows, obviously we know like there's going to be pressure applied on the bladder. Why people have to go to the bathroom all of the time. There can be a lot of pressure towards the rectum, which can lead to challenges with, constipation and all of that. But I want for you to appreciate how as the weight of the baby grows in here, all of those muscles, that hammock of muscles sitting at the base of the pelvic floor is really taking a lot of load, right? And so it's designed to do that. And it's a lot of load for those muscles. So just appreciating kind of that pelvic floor is really working very hard for people throughout pregnancy. And especially if there have been multiple pregnancies, just kind of the repeated load of those muscles, especially those those deep muscles inside the pelvic bowl throughout pregnancy to support all of the organs. Sphincteric, so basically the pelvic floor muscles are what allow things to go out when we want them to go out and to keep things in when we want it to stay in. So it's the health of the pelvic floor that will allow urine to come out at appropriate times, or if somebody has, we'll talk more about incontinence, but even like leakage of gas, like that is a function of the pelvic floor. Like if someone accidentally lets out a fart, like that is that's something, a lack of coordination of the pelvic floor muscles. Ideally, we want for them to release when we tell them to and stay closed when we want them to. Stability, the pelvic floor forms the base of our core canister. So whenever we talk about core, the core muscles, and again, like my background in Pilates, that's like such a focus, and people are very interested in core strength, especially, postpartum. There's a lot of, I want to regain my core strength because I feel weak in my core, or I'm having back pain because I'm weak in my core. The pelvic floor is a part of that. It's not just your abdominals, it's your deep abdominals, your deep back muscles. Your diaphragm is the top of it, and then your pelvic floor is the bottom of that core canister. So it's a really important part of how the whole core system works. And very often people forget about it and they just think, oh, I need to get my abs to turn back on, which is part of it. But the pelvic floor is an important piece of core stability. Obviously, a variety of functions related to sexual activity. And this is really, this is actually, I would say, 2/3 of the people that I see. This is like one of the big areas. It's returning to intimacy postpartum. It's the healing. It's the question of, it's the fear of pain. We know that actually an orgasm is a contraction and a relaxation of the pelvic floor muscles. And so if the pelvic floor is chronically tight and it doesn't have the ability to contract and relax, or if it's really weak and relaxed and it can't contract, like those can influence pleasure. And so those are pieces of the puzzle that I work with people around a lot. And just a very vulnerable topic for people to talk about. But that's how the pelvic floor is, it's one of the reasons why the pelvic floor is so critically important. And then the sump pump idea. So the sump pump idea is that the pelvic floor, and we'll go into this in more depth, but the pelvic floor moves, or should move. A healthy pelvic floor moves, and it moves subtly, and it has a little bit of lengthening and a little bit of contraction, or lengthening and return to rest. It should, with every breath, with the movement that we do in our daily activity. And this movement of the pelvic floor and of the diaphragm together are what help lymph to circulate. It adds to the circulation of our system, right? It helps blood flow, lymph, all of these things that we want to have a healthy functioning system. And so that's a really important component too. Very often there's dysfunction in the average person, like there's some dysfunction or lack of coordination around some of these pieces. And so we're not getting the full kind of movement and health of all the tissues that we'd want ideally. And certainly we see this within the pregnant and postpartum population as well. Okay, so I want to dive into a little bit more of this concept of the breath and how this relates to what's going on with the pelvic floor. So I want for you, wherever you are, to see if you can find a seated position where you feel both of your sit bones kind of equally weighted on the surface beneath you. And so if you're seated in a chair like me, it would have your legs about hip width apart, feet flat on the floor. And I'm going to invite you to just close your eyes for a moment if you're in a place where that feels comfortable. It's okay if not, just however you can access kind of turning inward. I just want you to notice. I'm just going to have you take a couple of breaths. And given what we just highlighted about where the pelvic floor sits, I want you to just really focus on that area, that base of your pelvis, pelvic bowl, thinking about those bony landmarks and where that hammock of muscle sits. And I want you to deepen your breath. You're taking big, full inhales and big exhales. Big, full inhales and exhale. And so I don't want you to change anything or try to do anything, but keep taking these big, full breaths. I just want you to turn your attention to the base of your pelvis here and see if you can notice anything that happens with your inhale and with the exhale. Do you feel like you can tap into paying attention to those muscles and seeing what might happen on the inhale and on the exhale? Just about 2 more rounds of breath here. And then when you're ready, I'll have you open your eyes back up if they were closed. And go ahead and add into the chat. Or if you feel like you'd like to speak, you're welcome to. But go ahead and enter into the chat. Were you able to feel anything happening to the muscles of your pelvic floor? So that's question 1. Yes or no. I welcome the no's. If you were like, no, I felt nothing. I did not feel connected to those muscles. But I'm curious. Okay, great. Okay, great. So some yeses. Martha, I appreciate you with your no. I'm sure there were more people that were no's. So a couple of you were able to tap into that. Okay. Okay, great. Tanya, you could feel it. Okay, when you inhale, you feel tightening. Okay, we're going to talk about that. Yeah, so this is good. It's good. Like there's a whole spectrum, right? Like, and it's interesting. Yeah, it's hard to isolate with the breath. Okay, good. So I appreciate kind of just taking this opportunity to do a little check-in to notice, because very often I find when I'm trying to cue people around this or I'm talking about this with others, it can be inhale tightening. Okay, we're going to talk about it. It's interesting to just like remind yourself, oh, it's really hard. It can be hard to connect to this area in the body, and just kind of think about what people's experiences of this can be. So I want to draw your attention to this image that I have here on the slide. And so what ideally should be happening is with each breath on your inhale, your diaphragm descends to pull the air into your system, right? And at the same time, because of that pressure in the canister, ideally your pelvic floor descends or lengthens towards the surface you're sitting on. And then on the exhale, it returns to rest. So it moves upwards. So every inhale, it should be lengthening. So diaphragm lowers, pelvic floor lengthens on your inhale. And then on the exhale is when it returns to rest or tightens. So inhale, it lengthens, exhale, it returns. So I'm going to guide us through one more breath. So we're going to do that again. And this time I'm going to add in a little bit of a cue and just see how that might change it for you or not. Okay. So let's go ahead and again, find that position where your sits bones, you feel equal weight between your right and left side as much as you can, and equal weight between the forward and back and your pelvis. I invite you to close your eyes if that feels comfortable to you. And then go ahead and really draw your attention inward, thinking about what's happening or just noticing what's happening at the base of the pelvic floor. So take a big full breath in here and a big exhale. And on this inhale, I want you to see if you can notice subtle movement of those pelvic floor muscles down towards the surface you're sitting on. And on the exhale, they return to rest as the diaphragm lifts. You inhale and they lengthen towards the surface beneath you. And exhale, return. Inhale, lengthen towards the surface beneath you. This time on your exhale, I want you to do what you think is a Kegel. So you're trying to activate, draw those pelvic floor muscles in and up, as if you're trying to draw those muscles away from your underwear, away from the surface beneath you. And then on the inhale, you release that. Notice that feeling of lengthening. And on this exhale, again, do what you think is a Kegel. Try to contract those muscles, drawing those side-to-side points, the front and back points, trying to lift, lift, lift. And then on the inhale, notice what that feels like as that contraction releases. Again, on the exhale, you're drawing in and up. Some people like to use like an elevator analogy. So you're going up first floor, second floor, third floor. And then on the inhale, you're lengthening and allowing the elevator to return. Second floor, first floor, ground. Again, exhale, drawing the elevator in and up. First floor, second floor, third floor. And then release and lengthen on your inhale as the elevator returns down to the ground floor. And then take a couple more breaths here and just notice if you can tap into that sensation. So not trying to do a Kegel here, but just notice on the inhale, can you feel that lengthening? And the exhale, returning to rest. And about one more round of breath here. And release. And then you can go ahead and open your eyes. So I'm seeing some yawns, some fatigue. We're getting that relaxation response kicking in, which I want to acknowledge is really powerful. This is a powerful tool that we all have for our own pelvic health and also for our new parents who are sleep deprived anyway and stressed out. If we can guide them through a deep breath sequence, it's really powerful. Like mechanically, it's helpful for the health of those pelvic floor muscles as they heal. And also it's really powerful for our relaxation response. And we can tap into that very quickly. So it's a tool that I always use. And it can be really helpful. So I'm curious, how any differences or any new reflections on doing it with the Kegel? Feel free to unmute or add into the chat. I'm curious for those of you that felt the inhale tightening during the first round, did any of that, were you able to shift any of that with more guidance? Jamie.
Yeah, I thought it was it definitely exacerbated the muscle relaxation and the stressing. And I know when I used to teach like birth classes, that was one of the key things I was trying to get, because a lot of people, when they hear Kegels or pushing, it's usually just that like clench without the full pelvic muscle movement. So I feel like that really gives an example of people opening up the blossom flower when they're birthing and breathing. So it kind of helps with that birth canal. So I could see how afterwards I didn't ever think to use that as a postpartum tool, you know, because I used it with a pre-birthing tool, but I've never used it as a post-birthing tool.
Awesome. Awesome. Thank you for sharing that very much. Yes, absolutely. So powerful postpartum. One thing I want to say too is that this, I don't know if you can see this very much, but like, okay, so we have some of the muscles. So if somebody's had a vaginal birth, some of the muscle groups go from the front, the pubic bone, all the way back to the tailbone, like this. And these muscles stretch up to 3 times their resting length during pregnancy or during vaginal delivery. And so that's a lot. And so in helping support that reconnection to the muscles and helping them return to like knowing what contraction, what it is to contract, what it is to relax. And a lot of people who come to me for birth prep as well, they say like, oh yeah, I need to get my pelvic floor muscles really strong to push the baby out. And it, it's like, no, we want to allow like the relax, we want to retrain, like relax and lengthen to support baby's passage rather than like your uterus push it. It's not like the muscles forcing it out. So yes, definitely reconnecting to the breath and like helping that visualization can be really powerful. So thank you for sharing that. Okay, let's see. Okay, good. I'm glad. Yeah, the elevator analogy can be really helpful. Inhale, tightening and relaxation after exhaling. Inhale, tightening. Lexus, I'm not sure what. Inhale, tightening. We want to try to exhale with the tightening. Feel free to hop on if there's anything that you'd like to speak to related to that. That I could help clarify. You can control.
Oh,
Okay. Oh yeah. Yes.
it's me.
Hi.
No, I just it felt good for me, honestly, because I do
Great.
pelvic floors, so it
Yes.
felt kind of when I do the pelvic floors,
Uh-huh.
um, laying down,
Yes.
um, when you inhale and when you tie the pelvic floor muscles,
Yes.
then when you exhale, it relaxes.
Mhm.
For me, I don't know, maybe I was doing it wrong, but it felt good. I'm not
Good.
sure.
Yeah, we definitely, yes, it can be really, it can be helpful to, yeah, spend a little bit of time. Thank you for sharing that. Like just checking in, allowing space to focus on the breath, connect with pelvic floor in this way. We do want on the inhale for it to lengthen, on the exhale to return or to tighten. But it's really can be a nice kind of mindfulness exercise to just tune in to the pelvic floor in this way. With people, so whether it's vaginal birth or C-section, because the pelvic floor has spent such a length of time supporting the growing baby, there are implications for the pelvic floor no matter how the birth occurred. So that is something that I make sure to communicate, is because very often people who've had C-sections say, oh, well, nothing happened to my pelvic floor, or it should be fine because I didn't give birth vaginally, or there's like a misconception there. And while true, there might not be some of the perineal tearing and that kind of thing, their pelvic floor was impacted giving birth via C-section. And so there can still be, lengthening of those muscles, lack of coordination from those muscles just through the pregnancy, through that duration of the pregnancy. So, so these are still really helpful tools to use for people who have had C-section or vaginal birth. Depending on, yes, the hysterectomy can influence, it should, in general, the musculature should follow the same pattern, but there can be some challenges or differences with, depending on what procedure was done, some like connective tissue pieces, some scar tissue pieces. And so all of those are that's why I love the work that I do. It's like, it's very interesting and nuanced, and it differs from person to person. But in general, on the inhales, we want to feel this lengthening. On the exhale, we want to feel a return to rest. We want people to know that your pelvic floor can be at rest and it doesn't always have to be clenched and holding tension. That's another thing that can cause people some pelvic floor challenge and dysfunction overall if they're holding tension at all times throughout their day. So that's something that I encounter. Like, I encourage you to just check in right now for a moment. Do you feel like you're like clenching the littlest bit in your pelvic floor? Very often we are. Like, we just are holding a little bit of tension there, especially if, like, let's say your morning coffee and you're like, oh, I think I might have to pee. Like, you might be holding a little bit of tension there. So I encourage people to see, okay, can I relax? Can I release those muscles a little bit to promote a little bit better coordination of the system? Okay, thank you all for that. All right, so let's keep moving forward here. So just wanting to highlight the relationship to posture and body mechanics. So when someone has given birth and now like their deepest layer of abdominal muscles, the transverse abdominis, it has horizontal muscle fibers, and that's the layer that stretches out the most when people are pregnant. And so then they've given birth, their core is weak, Their pelvic floor might be weak. They're needing to carry a newborn for hours of, each day. And very often we see this posture at the left where it's like sitting into the lower back, because this is like your back muscles are trying to provide you with the strength that your core doesn't have, right? So you're like sitting into the back. And so I often hear, and I'm imagining you all do too, that people complain of low back pain because they're in this position. And so one of the things that we can try to encourage is when they're holding baby, can they be more to the position on the right, where ideally we want your diaphragm or your ribs stacked over your pelvis. And that's kind of promoting increased, enhanced pelvic floor coordination and better coordination of the whole system. So you're using the muscles that you're designed to, rather than it all be loaded in like your lower back. So when possible, trying to shift and encourage people towards a position where ribs are stacked over pelvis. So okay, here we go. So this bleeds over into like all of the tasks during new parent phase, where a lot of times parents are rushing through whatever they might need to do, and it's like the baby's crying, I just want the baby to stop crying, like, or you get into a rhythm of just doing. This was something that was really hard for me. Like, I have a background in ergonomics. I give birth to my child. I know that I'm doing things over and over in a way, like, I'm like, there must be a better way. Like, there must be a way where if I set myself up, like if I have these pillows here, if I think about where items are spaced in my environment, that I'm not awkwardly reaching in all of these places while trying to make sure my baby doesn't roll off of the surface, like but it was very hard for me to do that when I was just trying to care for the infant. So this is something that can be really helpful to support new parents, like provide education around and support new parents around, is how can they have their space set up to minimize the additional strain that's going to be on their body, especially with some of the tasks that they're doing repetitively. So Terry, if you're available to put that other handout in the chat too, that would be great. So I like to provide some information to parents about some of the different ways in which they can handle some of the body mechanics for these recurring tasks that they might be doing. So, for example, with feeding, can they add in some support, additional pillows, have pillows available or blankets available so they can lift baby up towards them rather than rounding forward towards baby? Do they have a way that they can carry their baby, with a baby wrap or baby, some kind of baby carrying system that works for them? If they have access to different kinds of baby carriers, like I provide education. Sometimes people, have one kind of baby carrier and they're like, oh, actually like a baby wrap works better for them for whatever reason. And, obviously this depends on what resources people have available. But there are some places in the community that even offer like baby wearing, or at least up here where I am in Sacramento, they offer different, like they loan out different baby carriers or baby wraps. So people can test them out. And then sometimes people will look on like a Facebook marketplace or free baby sharing, baby supply groups. And I don't know what you all have access to, but it's helpful if people know, oh, I like this kind of wrap or I like that kind of carrier, and educating people that there are different kinds of carriers that have different kinds of adjustments that might feel differently comfortable for you. And so, so guiding people through all of that, because I think, especially for new parents, there can be a sense of like, oh, well, this is just what it is. This is the carrier and this is how it came and that's how it works. And they don't realize, oh, I can adjust it. Like I can lift the baby higher on my body or a little bit tighter so the baby's closer to me to help with that base of support, that center of gravity. And so this is something that might be intuitive for some people, but is not for many other people. So something that can be really helpful. And then you think about how this connects again with where the ribs are stacked up, where the pelvic floor is stacked up. These pieces are really significant for the overall enhancing the healing of the pelvic floor. So the little guide that I've shared, thank you, Terry, for adding that in, has some general tips that can be helpful for parents in navigating the postpartum phase. I know that you all, or I think based on what Jennifer shared with me, you all have exposure to the parents within the first couple of days, like up through the first couple of days after birth, right? But you're not necessarily going in repeatedly beyond that, is my understanding. And so I wanted for you to have something that either, you know, that you could leave with parents, or some tips that might be helpful for you to share with parents during that initial visit postpartum, or with a partner, if the partner's there, with family member, that would be helpful kind of ongoing as they navigate that period of the journey. Okay. So another piece related to all of this, I'm just going to briefly touch upon this, is this intra-abdominal pressure piece of this. So, so basically our core canister that we've talked about, diaphragm on the top, pelvic floor on the bottom, your deep abdominals through the front, and then your deep back muscles at the back of the core. That system, that muscular system, serves to help stabilize the pelvis, because we know we don't have any bones around that portion of the body, right, where all of our internal organs are. And we need something that helps our spine function in daily life, and when we're doing tasks that require muscular exertion, the core canister helps to stabilize our pelvis to make sure we stay safe. So when people have gone through pregnancy, you can imagine how their diaphragm or their rib cage is tilted upwards, their pelvis is tilted forward. So like we saw in that picture of the woman holding the infant, they're kind of like sitting back in their posture here. And that influences the core canister and the way that the pressure is distributed throughout the whole system. So one of the pieces that can be helpful throughout postpartum healing is how can we manage the load, or manage that distribution of pressure throughout the system, so one part of the system isn't taxed more than the rest. So this connects to what I was saying before. So we don't want the lower back to be taking all of the load where none of the rest is starting to turn on. Or we don't want the pelvic floor to be taking all of the load because none of the rest of the system is working. So this concept of intra-abdominal pressure, it's generated anytime the person lifts up the infant. They need to stabilize, they need to generate some pressure. Intra-abdominal pressure is generated anytime somebody is going to the bathroom and having a bowel movement. They're generating that intra-abdominal pressure. And so we need to be equipped to, or the goal is to help that pressure be distributed equally, because over time, if it is not, that can lead to challenges and dysfunction. So some of the ways in which, well, some of the common conditions that we see related to the pelvic floor. So we talked briefly about perineal tears. So if there's been a vaginal birth, very often there's a tear that occurs right here. This is something that people tend to be very fearful of prior to giving birth, but something that we know is quite common. Depending on the severity of the tear, you know, it might just be a peripheral, or a tear that only impacts like the most superficial layers. But as you move forward, grades 3, 4, they might have a tear deeper into the muscles. So this is something that can be helpful for people to know. Like if you know that you're working with somebody who's had a grade 3, 4 tear, and I'm not sure what resources are available through your system of referrals, but certainly if there's a way to advocate for pelvic floor therapy, I would encourage that when possible, because just kind of supporting the scar tissue as it heals here. So this is something that I'll do, is I'll provide some mobilization of the scar tissue to that area, but that's definitely something that's very common that I see. And again, like this leads to a lot of, this can be related to, you know, birth trauma and people's healing connection with, you know, partners or sexual experiences afterwards, fear around giving birth during future pregnancies if they had any tears here. So this is like really significant. And so I'll just share too, like there are people who come to see me and a lot of people say like, I just want to know that I'm normal or that I'm okay down there. That's like literally what they'll say. And we'll do an assessment. Maybe it'll be visual. Sometimes people will say like, I had a tear. I know it was only grade 1 or grade 2, but I just feel really nervous. I don't want my partner to touch me, that kind of thing. And so with consent, I will just place a finger here at the perineum. And without I don't apply any pressure, like as a first step, I just say, is it okay if I, place my finger here at the perineum? They give their okay, I'll place it here. And their whole body is just totally, you just see the stress. Like they're not breathing, they're clenched, they're just like so fearful of, I don't want to say it's a big deal to have a finger here, but, no wonder someone wouldn't feel ready for a sexual, encounter with a partner if their body has that full response to finger, placed there. So then what I'll do is place my other finger simultaneously, like on their leg or on their arm or something, so their brain starts to know, oh, okay, she's not applying any pressure, and it's this like rewiring of, okay, because your body interprets like any sensation there, or can interpret any sensation there as intense pain. And so we have to kind of rewire the system. Okay, it's safe, it's healing, the tissue is healing. I'm allowing myself to relax. I'm allowing breath to move there. My pelvic floor can lengthen with breath. So just a little kind of glimpse into what some of the therapy that I do with people can entail, is just safe touch in that way, so they know that they're healing. And we might do some more mobilization when they're ready, but I don't jump into that if somebody is fearful of me placing a finger here. I'm not going to say like, oh, we need to get in there and break up the scar tissue. Like I've heard of some therapists that do that, and for me, that's not going to be helpful for their holistic healing if I'm like, let's just get in there. So it's a really sensitive area that I will provide some support around. Pelvic organ prolapse. So that is when we talked about how all of these muscles sit in this pelvic bowl, all of these organs sit in the pelvic bowl. And so pelvic organ prolapse, what that means is just that the organs are sitting a little bit lower in the bowl than they were originally. So that, if you hear prolapse of the bladder prolapse, that means the bladder is just sitting a little bit lower than it was. And so you can have prolapse of any of these organs, uterine prolapse, rectal prolapse, rectocele. And the sensation of that for someone can be a little sensation of heaviness, or a big sensation of heaviness, or like a tampon falling out, those kinds of sensations. And it's not uncommon for people to experience heaviness during, second, third trimester of pregnancy. But if the heaviness if the heaviness continues, or they continue to experience like a sensation of a tampon, something like that, or something in there, that might be indicative of a prolapse. A lot of people experience prolapse where their organs are sitting a little bit lower than they should, but they're asymptomatic. Like it doesn't bother them. They don't notice anything about it. But when I look at their pelvic floor musculature, I can see the organs where I wouldn't normally, but they don't experience any symptoms related to that. So that is something that can be common after birth, and also can resolve depending on the severity of it. But it makes sense that if these muscles have been stretched out and are weak, and especially with multiple pregnancies, or if someone is always bearing down, let's say to have a bowel movement, and all of their pressure is going down towards the base of the pelvic floor over time, you can imagine how the system would be taxed ongoing. And so those organs might be sitting a little bit lower than we want them to, ideally. Urinary continence is something that a lot of people come to seek out pelvic floor therapy for. That can be, you know, how people talk about, oh, I just had a little leakage, or I won't jump. You know, we're talking further on during the postpartum phase, but like I feel nervous to jump on the trampoline with my little one, or I can't run after my little one without leaking. This is related to the ability of the pelvic floor muscles to be coordinated, to be able to contract and relax, to be able to allow. Remember, we talked about the sphincteric functions of the pelvic floor. Like, we only want things to come out when we want them to come out. We don't want things to come out when we're not intending for them to come out. And so that is related to pelvic floor dysfunction. So it is very common, but it's not normal, and it can be helped. So I really want for you all to know that, for you individually as people, and for the clients that you serve, urinary incontinence is not something that needs to be lived with. It can be addressed. Hemorrhoids are similar in a way to the pelvic organ prolapse, where basically, you know, there can be, with continued pressure towards the anal opening, things can come out that we don't want to come out. And so that's something that we see, especially related to the constipation challenges that can happen throughout the perinatal phase. And then diastasis recti, I just wanted to mention briefly, while it isn't necessarily related to the pelvic floor exactly, diastasis recti is also known as ab separation. And it's where the linea alba, or the connective tissue between those six-pack muscles, separates and thins during pregnancy. And everybody has it by the end of the third trimester. Like, your body has to accommodate the infant in there, the fetus in there. And so there is a bit of separation, but one of the main concerns for people is, will that heal postpartum? And for many people, it does heal on its own within the first 6 months postpartum. For other people, it requires a little bit more focused corrective exercise to heal. And so that is something that I see a lot of. And one thing that you all can do during that immediate postpartum phase is help people know that they shouldn't try to like lift themselves up out of bed. Like, they're laying on their back and they try to like lift themselves up because their abs aren't yet ready for that. So encouraging side rolling, side lying, and then to press up when they sit up. And same when they're going back down, like lay on your side, roll on your back for a bit of time immediate postpartum. That's really important for the healing. Okay. And so we talked about kind of the role of intra-abdominal pressure management, but all of these pelvic floor dysfunctions, it's like a whole system issue. It's not just like one part of the system. So I want for you to kind of leave thinking about how your whole body works together to help all of these pieces function well. It's the breath, it's the positioning, it's the muscle quality and tone, it's the mental well-being, the stress of the system. And so any point in which you could provide some support and encouragement is a good starting place for your clients, you know, for the patients that you're working with. If there's any entry point to any of this, that's great. I recognize that there can be a lot of information. Again, like speaking from my experience giving birth, like I just remember people coming in and they were like telling me information for me about my own healing. They were like telling me about, you know, my infant, make sure that, you know, that she does this and make sure you're, you know, and it was just like overload. And so I know that there's a lot of information and a lot of ground that needs to be covered during this time. And so just kind of wanting you all to have an overarching sense, while recognizing that maybe not all of this is going to be able to filter to every client you're working with, but it's helpful for you to have a deep understanding of. So some strategies to support this pelvic floor healing. I am very much a fan of encouraging the rest. And so, you know, I think, you know, like I mentioned, I'm most often seeing people a couple weeks after having given birth. I'm not in there. You know, while I am certified as a postpartum doula, like I'm not doing that work now. And so I'm more seeing people a little bit later on. But my kind of overarching message is like the tissues need to heal. And the people that I see feel like I don't know, there's some societal norms of what should be achieved, or, you know, maybe they're in a household, maybe they don't have the luxury of resting, you know, like they have many other kids, they have to get back to work, they don't have partner or community to provide support. And so I acknowledge those pieces. However, when there are supports in place, or if there is family around, or a partner who can help, or any pockets of space to advocate for that parent to get rest, I really encourage that. And especially because I work with people who are interested in regaining their strength and reconnecting to their core. Very often they're like, I want to start moving, or I want to start doing my exercises. And your body just really needs to rest during that initial postpartum phase. So I'm big on encouraging that. In terms of logistics from a pelvic health lens, one of the areas that people often are very fearful around is toileting. And so here's some tips around that. Certainly making sure, and if they're breastfeeding, like so much water, right? But the water and fiber piece, in order to minimize constipation as much as is possible. But beyond that, thinking about positioning. So if you are in the home environment or in the hospital, wherever you're working with this patient, when they go to toilet, can they be in a position where they can be fully relaxed? So what this means is, because remember we talked about like your pelvic floor, these muscles, we want them to be relaxed, especially when you're urinating or having a bowel movement. We don't want them to be clenched. That makes it harder for the system. It like leads to this discoordination. So we want your pelvic floor to be able to relax. So do they have a position where they're able to sit with their feet flat on a surface rather than dangling? And we want, ideally, knees to be higher than hips. So this is why squatty potties are excellent. If there's no squatty potty available, is there something in the environment that they can put their feet on? So maybe turning a small garbage can sideways, maybe stacking, like whatever you see in the environment. Can something be stacked so that person can have their feet flat on something and their knees higher than their hips? That creates the angle in the anorectal angle such that it's supportive of the bowels to empty. So if they're in a position where then they're totally relaxed, knees are higher than hips, can they use the breath to help them initiate if it's a bowel movement? So the idea is starting and not a clenched, excessive intra-abdominal pressure, kind of like forceful push, but if you start an exhalation to generate that intra-abdominal pressure to then have a push with that bowel movement. So the pressure, the intra-abdominal pressure generated, is helping to push or to empty the stool. One of the main areas where people feel like nervous and don't want to have a bowel movement, or it's very scary, is that sensation of when that intra-abdominal pressure is generated, the pressure goes where the areas are weakest. So if somebody has had a C-section incision, they're going to feel the pressure there. If somebody has given birth vaginally and has had a perineal tear, they're going to feel the pressure there. That doesn't feel good when your body has been, cut or has an injury to that area. It doesn't feel good when there's pressure going there. So if somebody has had a vaginal birth, it can feel good to apply a little bit of compression to the perineum so they feel supported and like they're not going to rip further there when they have a bowel movement. Same thing with the incision on the C-section. If they apply a pillow to that area, it can allow their body to relax. It feels better. It helps them evacuate when the pressure feels managed like externally in that way. So those are a couple of like really powerful tools that can be used. So then additional strategies. So if people, are in a space where they've been able to rest, they're using the restroom, what else can they do? So the number one thing that I support is the 360-degree breath. So again, we talked about like how this connects you to your relaxation response. It helps get the pelvic floor muscles and the whole canister functioning, like coordinated in its effort. And so, so I'll invite you to do this one with me. So again, find your comfortable seated position. You can find your sit bones on the surface beneath you. And for this one, I want you to place your hands, let's see, like on the sides of your ribs, like so. So the thumbs are pointing backwards towards your spine. Yep, and on either side of your ribs. Okay, so if it feels comfortable to you to close your eyes, I invite you to do so. Otherwise, just have a soft gaze downwards. And I want you to inhale and just take a big full breath in and a big full exhale. I just want you to notice that on your next inhale, notice the movement of your ribs as you inhale and exhale. Big full inhale and big full exhale. Good. Now, as you're doing this, can you fill up your ribs into the palms of your hand and into your thumb? So keep inhaling and see if you can fill up the sides and back of that core container. And exhale. So the goal is really filling up the sides and back of the body. And exhale. You can keep your hands here if you like this cue, or you can just relax your hands into your lap and see if you can take a big full breath in. Still filling up the sides and back of your body, and a deep full exhale. Now you keep breathing like this, and I want you to see if you can soften your jaw, soften your neck, soften your shoulders. 2 more rounds of breath here. One more round of breath. Okay, now I want to add in just one more cue. So you're going to keep with this sensation of breathing, and I want you to imagine that you've got a balloon inside your body, and on your inhale, the whole balloon is filling up. And so it's allowing the sides of your body, the back of your body to expand, the pelvic floor to lengthen. And on the exhale, the whole thing shrinks back down. So inhale, so you're expanding from the inside of your body. The balloon is growing in all different directions. And exhale. And one more like that. So it's a big full inhale. The balloon is expanding and growing. And exhaling. Then you can go ahead and release. And so that 360-degree breathing can feel really, really nice. And especially when during pregnancy, because, you know, as the baby grows and all of the like internal organs get smushed up and the diaphragm gets like a little bit smushed, the diaphragm like isn't used to like having that big space to expand. So we want to remind, like very often I'll see people after having given birth and they're breathing like only in their stomach. You know, their stomach is going up and down and there's no movement happening. Like there's nothing stretching on the sides of the body and the back of the body. So that can feel really nice. And that could even be something like baby is on the chest. You know, baby is just like here on the chest, you're holding baby. That can be good for bonding, for co-regulation, right? Baby is resting on the chest and you're just encouraging deep breaths for mom, you know? And we're stretching the sides and the back of the container. So another movement that I'll do that can feel really good, especially from extended amounts of time, like holding baby, carrying baby, is opening up the side of the body. So the side stretch like is pictured here, or somebody can just be seated and bend sideways. But again, finding some length and space in between the ribs, because in general, that area feels really tight and compressed. So I support, you know, any kind of bending to the side and then opening up of the chest. So especially if, you know, people are with all of the feeding that happens, breastfeeding, chest feeding, any kind of feeding, there's a lot of like hunched forward postures that happen at the very beginning. So if you encourage, like, so I call them, I'm not a football person, well, I should say like the 49ers. Okay, whatever. I'm not a football person, but touchdown arms or like goalpost arms, and just opening the chest a little bit, or like just extending the arms out wide. Like this can feel so amazing, just giving people permission to just like, I would encourage you to do this one where you're seated. Like this is good for us. Like if we're at the computer typing, just open and just like take a breath in, turn the palms up towards the ceiling, take an inhale and exhale, release. It can feel so good, right? To just open the front of the body, right? And just some like gentle shoulder rolls. So these are some things that while you're not directly impacting necessarily the pelvic floor, what we're getting is some relaxation in the system. We're getting some expansion in other portions of the body, like the sides, the back of the body, the front of the body, that support kind of the more even distribution of pressure in the core canister, which then therefore helps the pelvic floor heal. So these are some of the things that if you're working with somebody immediately postpartum and you just feel like, they need a little something, a little self-care, a little bit of stretch, a little bit of relaxation, these are some simple tools that you can have that could be helpful. Okay, just quickly want to touch upon, because this is really near and dear to my heart, all things perinatal mental health. This is such a significant transition time for people, and whether it's for, certainly if it's their first child, but even if they have many children, this is a new child that that's entering the family unit, and so that can bring any of these symptoms or these situations along with it. So just acknowledging that very often there can be this lack of control that is really disconcerting and can be very hard for people, and that can be influenced by what the support system is around them, and what the other factors they might have control over or not within their context. And so it can be a really challenging situation. And so that's where some of these grounding techniques or some of the mindfulness exercises, like you might not have control over when your infant wakes up or when your infant starts crying, but you do have control over taking 1 or 3 deep breaths for yourself to just center yourself, figure out what you're going to do, that kind of thing. Really powerful. Sense of disconnection. And so you might encounter, so in general, we know that given the shift of hormones, it is not uncommon for there to be baby blues within the first 2 weeks after giving birth. But when kind of feelings of disconnection or lack of bonding with the infant or apathy, et cetera, continues on, then it could qualify as a perinatal mood and anxiety disorder, which affects 1 out of 5 within that first year of life. That's a lot of people. And very often, people have heard of postpartum depression, but they don't know about postpartum anxiety or postpartum OCD or postpartum PTSD, so there are a lot of different mood and anxiety disorders that can arise here. And so just important, given the way in which you all are connecting with people, to have an awareness of this. And I think some of the research shows that very often a lot of screening does not happen around these because people don't know what to do if somebody screens positive. And so to whatever capacity you're able to in the places that you're working, coming up with some additional resources and kind of a protocol for screening, and then providing additional support or connecting people to resources. And I'll share some with you shortly. But the fact that each day is new can be hard for people, where it's especially during that infant stage where they don't yet feel like there is any kind of routine and they don't know what's happening. And each day is new, reminding people that, okay, you can have a fresh start. So it can be challenging. It can be challenging during this time, but just kind of allowing some grace and supporting people with this, acknowledging the shift in identity, especially if this is the first child, or again, like this can show up at any time throughout where people are navigating this phase. And then the performance expectations. So again, this might be connected to kind of social expectations of what they feel like they should accomplish. This could be expectations from a partner for family, around what is supposed to happen. So a lot of what I do in this work is encourage self-advocacy too, kind of figuring out, okay, do we need to talk about what are the expectations for people when they come to the home, or what are your expectations of your partner, or what, just talking those things out, because this is left. This conversation doesn't happen all the time, and it can alleviate a lot of mental health challenges to navigate, like for the person to feel like they have somebody to kind of think this through a little bit. Like, what supports do you need? Let's figure it out, and let's find out what resources we can help you find related to that. So a couple of additional resources for those of you that are on social media and like information in that way. I wanted to share a couple of accounts. So the Vagina Whisperer, Dr. Sarah Reardon, is a physical therapist that has a lot of really, really great pelvic health education that she provides, little snippets. I have some clients that really like, she also has like subscription-based exercise, like what to do within the first 6 weeks after birth, etc. The Body Ready method has some good tips. That would be a little bit more for people as they're preparing for birth, but really good information about like the pelvis and how it works and how it moves and how you can support preparing the body before birth and after birth. And then from a mental health standpoint, I wanted to make sure you all are aware of the maternal health hotline that launched last year. I haven't used it, or I don't have firsthand knowledge of anyone who's been able to provide me with a report of how that has gone, but I am really excited that it now exists. And so it is designed to be a free hotline that anyone can call to say, I'm having a hard time. And so my hope, I don't know exactly what all the follow-up resources or, what that looks like, but I wanted to make sure you all have that line. And then Postpartum Support International is a really exceptional resource as well. They do have a warm line, they have a crisis line and a warm line for people who are having challenges. They also have a variety of different online support groups, virtual support groups, for all the different kind of subpopulations you might be encountering. So they have some related to grief and loss, like infant loss. They have some related to, I think they have some for, partners who are trying to navigate, maybe the birthing parent is experiencing a perinatal mood and anxiety disorder, and the partner is having difficulty navigating that. So they have some supports around that. So it isn't the most friendly website, I would say. So it takes a minute to kind of look through there and familiarize yourself with what resources might be available. They also have a directory for people who provide resources, like a regional directory. So you could look on there to see if there are any providers in the area that might have offerings or resources, local resources for you all. So with that, I wanted to open it up to questions and discussion. And actually, I will throw this slide up there. Oops, this one. So that's all my contact information. So you have it. You can always email me. I have my little Instagram account. I'm trying to get better with, posting educational reels and resources and things that would be helpful. Whenever I do this kind of thing, it's motivating to, I just want people to have education and information, and like bite-sized, approachable tools that can be used. So I'm open to, if there's anything specific that you're like, I would really love a little social media thing about this, like that might get me going on my my real game a little bit more. But I have some things up there, a lot of like relaxation kinds of little tips and tools. So you can certainly find me there. And if you have any follow-up questions that you want to ask, like outside of this space, you can certainly email me as well. But from there, I will stop my screen and I would love to open it up to any questions, comments that you all might have. We covered a lot of different, there was a lot that we talked about, or that I talked about to you. And I would love to open it up.
Any questions or comments for Dr. Carlin? And if you are nervous to speak out loud, you can anonymously chat it to me and I can say it for you if you'd like. But you know, you're more than welcome to unmute. No?
In the meantime, I would like to, and it's okay if you don't have any questions. Oh, good, I'm glad. Yeah, I'm curious, just based on kind of what was covered, what you feel like is most helpful to you. Like what is a takeaway or something that you'll have in your mind as you do the work from this point forward? I'm glad you enjoyed the exercises. I do think, you know, some of those mindful pieces and just allowing space for, you know, turning inward and just connecting to your breath, connecting to your body. I did also, good, I'm glad. I did also want to share, you know, maybe if the person isn't in a space where they want to do like a 360-degree breathing activity, it can be really, really powerful to have mom place her hands on her stomach, and just take a deep breath, like after having given birth. And sometimes mom, they're not ready to do that, like, because that can be, that's a big step, you know, to just even like feel your own body and feel your own body without your baby inside. Like, very often I'll have people do that, and it's just, you know, it's a powerful release, but that is very healing, can be very healing. A little further on too, sometimes I'll have people just place their hands if they had a C-section, like, because it can require a lot of steps to work up to even placing your hands, like not even touching, but just like placing your hands on that space. And so allowing breath and guiding breath and just thinking about like nurturing that part of your body or acknowledging that part of your body. And that doesn't resonate for everybody. You know, that can be a little bit, I don't want to say woo woo, but like, you know, some people are like not into acknowledging their body and its work, you know, but other people that's really, really powerful. So so just wanted to offer that to you. It's just, you know, and if nothing on the stomach yet feels comfortable, placing hands on heart can be really, really powerful too. So yeah, I'm glad that seems like you all, you know, got some good information, some good exercises, movement that you can do, some concrete tools and strategies. So I'll plan to hang out here for a couple minutes if anybody feels like they have an additional question that you want to ask. But again, feel free to email me at any time. Oh, good question. Belly wrap. So the belly wraps, okay. So the short answer is I think belly wraps can be helpful immediately postpartum. Many cultures use belly wraps as part of the postpartum healing. And there's reason for that, because if this has all been all stretched out, and that compression and the support for the healing of the tissue can feel good, can help the tissues heal, that kind of thing. In terms of long-term belly wrap usage, I wouldn't recommend it. It depends. It's a big depends. It depends on the client, what's going on. But when you think about what we talked about the pressure of that core canister, like if the belly wrap is done and it's over time and it's very tight, you can imagine how with every breath, their balloon, let's say, is being compressed from the front. And so that can put extra pressure downward on the pelvic floor that we don't want. And so if somebody is having already like pelvic heaviness, prolapse, et cetera, if they are binding too tight or too often, it can cause challenges there. And or it doesn't allow your muscles to learn how to turn on in the way that we want them to. It's like, it's support that, you know, it's like if you have an ankle injury or a knee injury, like you might want to use a brace for a little bit, but you don't want to use the brace the whole time always, because then your muscles aren't doing, like they're not learning how to get stronger, right? So it's a kind of like a, you know, you have to weigh it out. So they can be helpful initially, but I wouldn't in general encourage it for like long-term use. Multiple cesarean delivery mamas benefit with pelvic PT or occupational therapy. So I'll say pelvic floor therapy due to a heavy pelvic floor. Oh, that was, yeah, I got that as a direct question. I think honestly that every person who has ever been pregnant, and honestly people who haven't been pregnant, like I believe pelvic floor therapy, everyone should see a pelvic floor therapist. For sure, if somebody has had multiple pregnancies, absolutely. And again, I recognize this is an accessibility issue, so I'm not sure what is available for all spectrum. Like I'm working behind the scenes to do what I can to promote pelvic floor therapy accessibility to everyone. But certainly if somebody is talking about feeling heaviness in their pelvic floor and they are not third trimester, that to me is an indicator that they would benefit from having someone kind of provide an evaluation to figure out what might be happening. That makes me think there could be some prolapse or like either weakness of the pelvic floor muscles or ongoing intra-abdominal pressure that is pressing down on the pelvic floor muscles. So in the short term, some of the things, if somebody's experiencing pain or pressure downward, is exhaling when they're lifting, exhaling and trying to activate those muscles to provide support to manage the pressure. So if you exhale, you're exhaling and lifting, thinking about providing conscious support from the bottom up of the pelvic floor, then it's not just all your intra-abdominal pressure pressing downward, if that makes sense. So exhale to lift, engage the pelvic floor, engage the core when you're lifting, can be helpful. Good questions. See, I knew you all had some good questions. Yes, totally back pain related to the pelvic floor, instability, weakness, poor strength. Yeah, you might still experience people who have pelvic pain, like if they had SPD or symphysis pubis dysfunction, so pain during pregnancy, like right here, instability at this joint, that can continue postpartum because, you know, the relaxin and everything is still really unstable because it was making space for baby. So if somebody is talking about a lot of pain right here, encouraging them to keep their knees together, like if they're getting in and out of the bed, trying to keep their knees together rather than like swinging one knee out at a time. Same thing, getting in and out of a car, that can be helpful if they're experiencing that pain. But yeah, it's all related. So any support you can provide to any part of the system will be helpful in supporting the rest of the system. Great question.
I have a quick question. I had a client tell me she got some therapy from a pelvic floor therapist, and she said she stopped because it was really uncomfortable. The therapist, inserted her finger and pushed on the walls.
Mm-hmm.
What does that do?
Yeah, great question. Okay, somebody also asked, so I'm going to answer this question about time. So in general, it differs. Standard for pelvic floor therapy is usually around 6 weeks or after there's been clearance from the physician. Usually internal work doesn't happen until bleeding has stopped. That being said, I work with people, you should ask whomever it is, like different therapists will work in different time frames. So I will work with people, let's say 2 weeks after birth, because there's no care from 0 to 6 weeks. And people are like, I'm hurting, I have questions. So I won't do internal work, but we'll talk about breathing. We'll talk about some of these body mechanics, et cetera. So some therapists will work prior to 6 weeks, but just wouldn't do internal work until the bleeding has stopped. Providing internal therapy. So I don't do assessments or evaluations of somebody. I wouldn't ever do it if somebody like doesn't want it or isn't ready for it. It's not standard for me. It is for some therapists. So I would have you educate your clients if like they get to say if they are ready for that or not. Trauma-informed, like client-centered care. But what the goal is of any kind of intravaginal assessment or treatment is to palpate those muscles in general. So feeling along I can't do it in here, but like basically my finger would insert and I'm going to feel, okay, do I feel tension? Is that muscle able to contract and relax? Are there any tender points? Is there a scar tissue? That's what they're feeling for. And you can, let's say you find like a tender point, trigger point, you can provide some gentle compression, or if there's scar tissue or adhesion in there, you can kind of try to mobilize it, but nothing should ever be painful in general. You know, it might be a little bit uncomfortable, but it shouldn't be painful. Yeah, that's a big one. But that's what they're trying to do, is trying to soften, trying to assess the quality of the muscle tone, and then help support relaxation or softening or minimize scar tissue, mobilize it. Yeah. Good question. All right. Well, thank you so much for your time this morning. I really appreciate you all being here with me. And I look forward to, you know, being in touch, and just really deeply appreciate the work that each of you are doing, the hard work, like, and the important work that you're all doing for this population. So thank you all so much, and wishing you a great rest of your morning.
Thank you so much, Dr. Carlin. Can we please give Dr. Carlin a big virtual round of applause?
Thank you.
Thank you. It was very nice. Your presentation was amazing. And
Thank
of
you.
course, the slides and the handout that you guys got in the chat will also be sent to you. I know Jennifer will email all that to you. Also, along with the contact, please save Dr. Carlin's contact if you have any other questions that come up in the field. She is your definite resource for any other questions that you might find later on. So with that, I added the evaluation link to the chat, but I'll add it one more time just so you guys have it. Just make sure you please complete that evaluation by the end of the day. And then if you have any other questions, don't hesitate to email us, and we'll be happy to help you out. With that, that concludes our RN webinar for today. We hope you have a great day, everybody. See you soon.
Thank you all so much. Take care.
Bye.
Bye.
Bye, Dr. Carlin. Thank you.